everybody, welcome back. Today we're going to start talking about the skeleton, and in particular the skull. The skull is part of the axial skeleton. The axial skeleton is the head, neck, and trunk. The appendicular skeleton are the arms and the legs. So I have the lab practical list right here, and we're going to go through it mostly in order, although I'm going to talk about the sutures when I talk about the bones. And when you look at the bones, you can see that some of the bones just have the bone listed, and you don't have to know anything else about that bone, you just have to be able to identify it. Some of the bones have what we call markings on them, and a marking is just an area of interest. It could be a hole in that bone, it could be some part that sticks out that we're interested in some reason. And so those markings are indented underneath the bone they're on. So for example, the mastoid process is on the temporal bone. It's a marking on the temporal bone. You will need to be able to identify both the bone and any markings that are on this list. So we're going to start at the front of the skull. The sort of most obvious, easiest bone to identify is this bone right here, and that's the frontal bone. Behind that bone are the two parietal bones. These make up sort of the lateral sides of your skull. And there's a suture, which is basically this kind of wavy line, which is a joint between the frontal bone and the two parietal bones. This is actually called the frontal or the coronal suture. And a suture is a joint because it's a joining between two bones, but it's immovable. So it's not like the joints in your fingers or like your elbow or your knee joint that have a lot of movement. These actually have no movement by the time you're an adult. When babies are born, these sutures aren't always completely closed up, and that gives the bones a chance to be able to kind of get compressed during delivery, childbirth and delivery, as well as to grow so that the skull can grow during childhood. On the side, inferior to the parietal bone, is the temporal bone, and you'll see there's another suture right here. This is called the squamous suture. And we actually have two markings on the temporal bone. The first one is the external auditory meatus, and that's this hole right here. That's your ear canal. So sound comes in here, goes into this hole, and tunnels through the temporal bone to the inner ear, which is on the inside of the temporal bone. The other marking on the temporal bone is this kind of jutting piece right here called the mastoid process. And you can see it's rather rough looking on my skull here. And the reason it's rough is because there's a lot of muscle attachments there that go from there to the jaw and from there down to the collarbones. On the back of the skull is the occipital bone, and it is separated from the parietal bones by the lambdoid suture. Underneath the skull, so here we're looking at the skull, here's the front, you can tell it's the front because that's where the teeth are, and this big hole, this is one of the biggest holes in the skull, is called the foramen magnum. And this is where the spinal cord comes out of the brain and goes down the vertebral column, inside the vertebral column. We also have these occipital condyles right here and right here. So they're on either side of that foramen magnum. And these two condyles are kind of smooth, and they fit into facets that are on the first cervical vertebrae. That first cervical vertebrae is called atlas, or C1, and they hold up. So atlas or C1 would sit like this, and it holds the skull up. And because they're smooth like that, it gives the ability for you to sort of move your head back and forth and nod yes. The jugular foramen are two holes right to the sides of the foramen magnum. And again, foramen means hole. So this is big hole, and this is the jugular hole, jugular foramen. And these are where the jugular veins come out of the skull and go back to the heart. On the front of the skull, this bone right here that makes up pretty much the front of your face is called the maxilla. And then this bone here that's on the inferior portion of the nasal cavity is called the vomer. I'm going to skip over the sphenoid and the ethmoid bone. I'm going to show you when I open up the skull. But the nasal bone, there's two of them, one on either side, are these two bones right here, and they make up the bridge of the nose. And the lacrimal bone is on either side. So you can kind of see on my skull there's a little indentation in here, and that's where the tear ducts would be. That's what drains the eye sockets, or the eyes. The zygomatic bone is this bone right here. So that's your cheekbone. And this part right here where it sort of flares out, you see how it flares away from the skull? That's actually the zygomatic arch. Looking on the bottom of the skull, we have the two palatine bones. That would be right here and right here. So these two bones go sort of up this direction, and they make up the posterior portion of the hard palate. So if you were to take your tongue and put it all the way, like as far back as you can towards the back of your mouth, you would be feeling sort of this hard palate right up here, and the bones that go up into the nasal cavity from there are the palatine bones. The mandible is the only bone that's movable in the skull by the time you're an adult. I've taken off the mandible so that you can see a little bit better, but this is the mandibular notch. The mandibular foramen is inside the jaw. So if you look at it from the back side, you can see there's like a little hole on either side. Remember, foramen means hole. So the mandibular foramen is right there. That's where a lot of nerves come out and come through the bone from the teeth. So if you're going into dental hygiene and they feel like they're, going way back there with the needle, it's because they are. The mental foramen is on either side on the front of the jaw. And again, these holes leave space for nerves and vessels to come through the bones. And the mandibular condyle is this portion right here that's going to articulate with the temporal bone when the skull is assembled. The two bones that seem to give students the most trouble would be the ethmoid and the sphenoid bone. So the sphenoid bone you can see on the side here and here. I'm going to open up the skull so you can see the sphenoid bone from inside. So if you open your skeleton skull, take the top off, you look inside at it. So remember, this is the front of the skull. This is where the eyes and everything are. The sphenoid bone is right here. It kind of looks like a bat shape. Okay, this is the inside of the frontal bone. And this part back here is the inside of the occipital bone. So remember, there's the foramen magnum from the other side. There's the jugular foramen. And the occipital condyles are outside down inferior, the bottom part of the occipital bone. So on the sphenoid bone, you need to know the optic canal. This is the optic canal on either side. This is actually holes that go through, not sure if you can see, they go through into the back of the eye socket. So in the eye, the back of your eyeball, there's nerves that come out of it that bring the information back into the brain, and that's the optic canal that they go through, those holes. You also need to know the sella turcica, which is this area right here. It kind of forms a ridge, and in front of it is this little, it almost looks like a saddle, and that's where the pituitary gland sits. So it's very protected, very, very deep within the skull. The ethmoid bone is pretty hard to see. This is the hardest one. It's actually sort of inside the middle of your face. So the top of the nasal cavity here, you can see there's a ridge in there. That's part of the ethmoid bone. You can see a little bit of the ethmoid bone in the back of the eye socket. And you can also see the ethmoid bone poking through right here. So remember, this is the frontal bone. The ethmoid bone is just this part poking up. And this part is actually called the crista galli. And on either side of that are going to be the olfactory foramina. You can't see them very well here because this is just a model, but essentially they're little teeny holes. Remember, a foramen is a hole, a foramina is a really little hole. They're really tiny holes that go through the roof of the nasal cavity here, and the nerves that poke down into the nasal cavity that help you sense smell start here and then go up through those little teeny holes up into the brain cavity. So that's everything that you need to know about the skull. In your assignment, you will not have to mark all of those things, so just go ahead and mark the things that are written down on the list. But for your lab practical, you are responsible for being able to identify all the bones and markings on lab practical list number 2. Thanks for watching. See you in class.